chronic back pain? Have you tried pain relievers, injections, or even had multiple surgeries, but nothing seems to bring relief? Well, this is Dr. Christopher Chun of Minimally Invasive Spine Care, and he says you might want to try spinal cord stimulation. And Jimeline is a patient that he brought with him as well. And Jimeline, we're going to get to your story in just a moment. But doctor, let's talk about spinal cord stimulation and how this is helping patients.
Well, spinal cord stimulation, it is an implantable device. However, it is something that can help people with pain, chronic pain that maybe they've tried, like you said, the multiple injections. They've even had surgery, and they're maybe on high doses of chronic pain medicine. And some people may think that they don't have any hope, but this is definitely a modality that can help with their pain.
Okay, so let's talk about how it works.
Okay, so spinal cord stimulation, it works. Basically, the way that pain works is that, let's say if someone has low back and leg pain, the leg pain kind of goes up to the spinal cord, goes to the brain processes it, and then it tells the body basically you have pain. So what spinal cord stimulation does is it interrupts that signal and sends a tingling sensation down to cover up that pain, sometimes even completely relieving it.
Wow, it seems so advanced and music to the ears of so many people that are heavily medicated and think they have to live with this kind of pain. And Jimeline, you were one of those people who was suffering and then decided to see the good doctor here. So what was your story all about?
Well, I was in an automobile accident in '04, and after that accident, I just had increasing, excruciating pain. And before I went to see Dr. Chun, they had me on so much medication that I was afraid of addiction.
Yeah, sure.
So I asked him what we could do, and he did my surgery. I had absolutely no pain. Don't even take aspirin.
Wow.
And I feel great.
Yeah, I saw you dancing around the studio all day, so I know that it's true. And I'm sure when you have something horrible like a car accident happen, and you think that this is going to be a way of life for you now, you're going to always be on pain medication, you're always going to be uncomfortable. Were you surprised by these results?
I really was. I didn't get that much relief with the test that they did, but I mean, right after they put it in, I was pain-free.
Okay, that's really
Went home
great.
from the hospital the same day.
Oh my gosh. Again, that's motivation to so many people who may be suffering. So how do you determine who's a good candidate, and what would you say to somebody who may want to come and see you?
Well, basically, if people have tried a lot of different things, and if they've had surgery, if there's really no other place to go, that might be a patient that's a good candidate for it, or someone that's high risk for surgery. And it's something, what I like about spinal cord stimulation is that, unlike a lot of things in medicine, whether it be a pill or a surgery or even an injection, basically you can try it out. You can take it for a test drive.
Sure.
And that's what Jimeline did. She tried it out for a few days. There's a minimally invasive way to do that. And she had good results.
Well, she's a great testimonial for you, and it's great that you're seeing you in good health. And Dr. Chun, thank you for sharing the story with us today. And here's the information that you need to know. You can call this number right here, 888-600-6474, or log on to spinecaredfw.com. Carrie?